of all, I want to explain what an article is, what a journal is. I'll be starting from grade zero. Just bear with me. So, what is a journal? So, journal is like pretty much like our magazines. Let's say in Andhra there's Swati magazine, or all over India there's India Today magazine. So, journals are pretty much the same as magazines, but in the world of science. So journals report the latest discoveries or latest inventions that have been made in that specific month or specific year or in the specific time. So that's what journals do. So why are these journals important? Why are these articles important? Is because when you put something online, let's say you want to know something, you Google it. So how do Google give you the answer? Google gives you the articles that were written from the journals. Let's say you want to know what's better for a fever. You want to ask which antibiotic should you use for your sore throat, azithromycin or amoxiclav. You type it in the Google, azithromycin or amoxiclav. The Google just pops up some random article which says this is better. So what gives that article is a research which was published in a journal. So we have search engines which have modified a lot, but previously when there were no search engines, people had to go through the journals if they have any questions like this. So this is what a journal is, and this is what an article is. I hope you got the basic outline of what it is. So I'm Satwik Kuppili, an intern from 2018 batch of KIMS Andhra Pradesh. So I'm actually from SMR. So about SMR, we are Squad Medicine Research. We are not a registered organization or anything. We are just we can say a group of students who are mostly undergraduates and are very much interested in research. I'm actually not aspiring towards USMLE. I'm just interested in research. So if you are interested in research, you are searching for opportunities, or you have ideas but you don't know what to do, or you have time but you don't have any ideas, all you can do is you can join in the WhatsApp group of SMR, and if there are any opportunities, we post it in the group. Or if you have any idea, you can post it in the group, and we'll make sure that the idea comes into form of a research. So right now we have 5 ongoing manuscripts running on. So yeah, this is my a little introduction about me. So why research? So why do you need research? I so assuming that all of you are USMLE aspirants, so why do you need research in your CVs? So I think you already know the answer for this. Research gives you a huge edge, or research gives you a huge plus point from many of the people. If you have good publications, if you have a really good research in your CV that is related to your specialty, it gives a good impression for the person interviewing you to select you for the program, or for the program director to select you for the program. Because I think Americans prefer specifically people who are well oriented towards research, because they have research grants, they have like a research department, research wing that is completely dedicated in a hospital, in well established universities. There are completely dedicated research wings in which they have to show to their contributors, like the people who give them grants. They need to show that we have done this research and we have done this progress, and they even get rankings to the universities based on the research progress that they do. So obviously they would need good researchers who are actually doctors. So yeah, research does give you an edge over rest of the people. So what are the possible article types? So I told you that these are the articles, and these are published in the journal, right? So what type of articles can you possibly publish? So I'm gonna just read out, and I'm gonna explain each on every one specifically later. So the first thing is narrative review. So narrative review is pretty much you're summarizing multiple things in a single article. Let's say you read 10 studies and you summarize it into one paper with 2,500 to 3,000 words. That's a narrative review, and it's also called as literature review. And there's systematic review and meta-analysis. So systematic review is compiling multiple reviews in a specific form, in a systematic way. It's like you follow specific rules and specific steps to write this review. Narrative review, you can pretty much write in your own way. It's mostly freestyle. But systematic review has rules to follow. It has an inclusion criteria, it has an exclusion criteria. And letter to the editors, these are very short articles. These can be written very quick. It takes hardly half a day to one whole day to finish these. But mostly these are written by experts. These can be written by freshers also. My first publication is a letter to editor as well, but we'll come to that later. And case studies and case series. I think you can understand what a case study is. So case study is pretty much you see a case and you publish, you study about it, you make a systematic pattern, you put it in a systematic case sheet format, you write the discussion, you write the treatment of the case, and then you publish it in a journal. And the OG, original studies. So the OG means the real studies are the original studies. These are like, these have pretty solid impact. If you have a proper original study in your CV, if you actually do a proper original study, you will really start loving research a lot. So original, so all these things, all the other things you write from an original study, narrative review, systematic review, letter to editor, you extract these from an original study. So we'll start with the original study first. What is an original study? So original studies are basically pretty much in which you have to start from the scratch. Like you need to form an idea. Let's say you have an idea in your mind. uh, right now let's say you're posted in surgery department. In surgery, henioplasty is very common, right? Henioplasty is very common, hernia surgeries are happening. You want to know which drug is more effective in reducing pain. So we usually use paracetamol and diclofenac for pain reducing, right? So I'm not very sure. I just randomly took two drugs, names of two painkillers, paracetamol and diclofenac. You want to know which gives more pain relief. So what do you do? So that's when you start an original study comparing these two drugs. So the examples of original studies, you start paracetamol versus diclofenac. Let's say you take 50 people, you give paracetamol to them. You take 50 people, you give diclofenac to them. You see who have more pain relief, who's reporting more pain. So statistically, which you will analyze the results, and then you'll say that let's say paracetamol is more efficient, it's giving more relief. So what do you, when you publish this, when someone else who do henioplasties watch this article, they start using paracetamol, which will improve the lives of patients. And also this is a very basic study, but once you start doing studies like this, you'll have much more ideas. And program directors actually like people prefer much more ideas with the original studies. So there are different types of original studies as well. So this is pretty much what we have studied in SPM Park. Yeah, we marked up and studied it and we passed somehow. The first thing is randomized control studies. So RCTs, these are like the thing that I mentioned previously, paracetamol versus diclofenac. It's a randomized control study. You randomly took 100 patients, you randomly divided 50 and 50, and you gave drugs to them. This is a randomized control study. Whereas case control study, you have a control group of population. Like you take 100 people, separate into 50-50, and let's say you're doing a study on smoking. Let's say you're doing a study on how smoking affects people. You divide 100 people 50-50. For 150 people are the control group, which are which have similar type of things except for the smoking. Like the demographics are similar, the gender ratio is almost similar, the age groups are almost similar, but the only one thing that differs from the case group and the control group is the control group does not smoke and the case group smokes. So you're gonna compare the results in between the both and you'll analyze the results. So this is case control study. And the CAP studies, knowledge, attitude, and practice studies. In lockdown, you might have got a lot of WhatsApp forwards to fill these forms. The form saying screen time in students. So knowledge, attitude, practice studies are basically, they are mostly a questionnaire type of studies. You can, these actually can be easily done. You can get ethical clearance very easily for this. So you can just forward WhatsApp questionnaires to many people. So this is to know how much people know about something. Let's say, let's randomly take caffeine addiction. So you want to know how many people are addicted to coffee. You actually need to go down and collect the information person to person. You can forward a questionnaire to some person, and the person can fill the questionnaire, and your questionnaire has to contain all the questions which will know how much the person knows about something. If when you take caffeine addiction, you can, the questionnaire can be like, do you know about caffeine addiction? How did you come to know about caffeine addiction? Even though you know that you're addicted to coffee, do you still take coffee? So this is knowledge, attitude, and practice. These kind of studies are called as CAP studies. And finally, the clinical trials. So we usually use the word clinical trials. It's like we use it normally, but technically clinical trials are something, let's something when you take a drug which is never which is like a new drug and you want to experiment on something, or which is a known drug but it is a new property. Let's say I take paracetamol only, but I want to experiment paracetamol on the pulmonary abilities. I know this sounds stupid, but it's just I want to experiment on the pulmonary abilities. This is the clinical trial. But the pain killing abilities of paracetamol, if I want to experiment on that, that will not be a clinical trial. That will be a RCT or a case control study, because it's already a known property which I'm experimenting on. Whereas clinical trials, mostly clinical trials are done on new drugs, or known drugs, or known properties which are yet to be discovered. But we use RCTs and clinical trials very synonymously these days. So these are the types of original studies. Just know that you can unmute yourself and ask any question at any point of time if you want, if you feel like asking. So the second study is narrative review. So narrative review, or you can call it literature reviews as well. These are something that you do not. So for an original study, you need an ethical clearance from an institution. Not any medical college can give you an ethical clearance. You cannot do a narrative study just like that. You need an ethical clearance saying that this study does not have any ill ethical concerns. This study is okay to all the patients, or this study is okay to all the students. So it has to be given by an institution, or a very few private hospitals can give ethical clearance. There are very few in India, right? I don't think there are any in Andhra Pradesh, but in Hyderabad there are few institutions, and I have no clue about the rest of the India. So yeah, if you are right now in an institution, you have more probability of getting an ethical clearance for an original study. But whereas narrative review is a summary of already done studies. It's like you compile 10 to 15 studies and you write the summary, so that whoever wants to study later, they need not study all the 10 articles or all the 10 original studies. All they need to do is just look at your one paper, and they should know about all the 15 studies that were done previously. So this is the concept of narrative review, and narrative review does not need any ethical clearance. You can just randomly open your laptop, get an idea, just randomly type out some words, and you can write a narrative review. So this is more plausible, this is more feasible for us. So I put in plus and minus of the narrative reviews. So narrative review is usually small, 2000 to 3000 words. This is the average word limit for narrative review, and it's you can finish it if uh, if you are a little experienced, you can sit from 9 to 9, like 9 a.m. in the morning to 9 p.m. in the evening, and you can finish the first draft of a narrative review. It takes a little less time when compared to the other studies, and it's more feasible as well. And you do not need much supervision and permissions, because you don't need an ethical permission. If you have, like, if you have even at least one article experience, you can write a narrative review on your own itself. And even the journals responds more quicker to narrative reviews than to the original studies. So yeah, either acceptance or rejectance, you'll get a quicker response. And it's also more chances to get waivers for APCs. So APCs are article processing charges. Few journals charge for publishing your articles because it has to cover the publishing charges, and also they might charge more than it as well. So you can apply for a waiver. Let's say we are from India right now, right? So we are a third world country. So you can say that I'm from India, I'm a third world country person, research is a little backward in India, so please support us by accepting our article without any fee. And journals do give waivers if you send mails like that. So for a narrative review, journals easily give more waivers when compared to that of original studies. So what are the negatives is lesser weightage in your CV, unless it is published in a damn good journal like Nature, Springer, or something else. It's actually a little underwhelming than an original article, but nevertheless, it's good to have narrative reviews in your CV as well. And higher chances of getting rejections, because narrative reviews are basically summaries. So if you do not summarize properly, or if it's there's more chance to having a very clumsy manuscript with ourselves. So manuscript is the basic thing that you write. So when you finish drafting all your findings in a paper, that's what we call a manuscript. So if you have a very clumsy manuscript, you might get rejected easier. So yeah. So moving on, we have systematic review and meta-analysis. So I've told you that systematic review is also summarizing, but in a very systematic way. So in a narrative review, you can just randomly select the studies that you like. You can randomly include the studies that you like. You need not put anything. You need not explain your methodology properly and all. So what we do in systematic review is we need to write up a search strategy. So I've recently done a systematic review in which my search strategy was, I typed in these two keywords. My study was about sickle cell disease. So I studied sickle cell disease and India in the search strategy. You open PubMed. So PubMed is like Google it's like a search engine but for scientific journals. So yeah, I opened my search strategy would be, I opened PubMed and I typed in two words: sickle cell disease and India. So this is, and I should if I put this in my search strategy, I should not add any more word, or I should not decrease any more words in my search strategy. So this has to be very particular. And an inclusion criteria. So my inclusion criteria is, so you'll once you search, you'll get results of 10 pages, right? Some 10 to 15 pages maybe. So in each page there could be 10 to 15, 10 articles. So it will be 150 articles. So you'll need to have an inclusion criteria. So an inclusion criteria could be like, I'm going to include articles only between 2010 to 2020, and I'm going to include only Indian articles. You can have your own inclusion criteria, and any article which cannot be included in the inclusion criteria should not be included. And you should have an exclusion criteria as well. So your exclusion criteria would be any articles before 2010 and any articles after 2020 will be excluded, or any articles out of India will be excluded, or any articles, let's say, which do not have proper conclusions can be excluded. So if any of the 150 results comes into your exclusion criteria, you should exclude them. So, and there are guidelines called as Prisma guidelines in order to do a systematic review. So you should follow the Prisma guidelines to do a systematic review. And meta-analysis. So systematic and review and meta-analysis go hand in hand together. So what is a meta-analysis and what is the difference between meta-analysis and systematic review is, so let's say you compiled some 20 articles into one summary. So what does a meta-analysis do is, in all the 20 articles, there are numbers, right? So each article has a study population, let's say 150, 100, 200. So what do we do in meta-analysis is, statistically, we combine all the study population, all the quantities, all the qualities, and we bring out a statistics. So for example, let's say number of people who smoke in a medical college. This is something that we are writing a systematic review on. So we have 15 articles, one in KIMS, one in MIMS, one in GMC, one in somewhere else, AIMS. So we have some 15 articles available on the internet. You want to write a systematic review on it. So overall, when you say medical students in India, what you do is you take all the statistics from all the articles and you form it into a single statistical analysis. So that's how you make a meta-analysis. So every systematic review need not have a meta-analysis. You need not have a proper statistic review for every systematic review. It's your choice. If you want to put a meta-analysis in your systematic review, you can put it. So yeah, meta-analysis is optional. Many people, I'm not well versed with meta-analysis because it involves lots of either software or maths, both of which I'm very weak in. So there are softwares in which you can put the statistical details and they'll give you the results as well, or else you'll have to do the statistics by yourselves. Maybe you can get, if you want to do a meta-analysis, your SPM department can guide you well. So this is the Prisma diagram. So yeah, the data what are duplicates articles? So there will be some one out of, I told you, you'll get 10 pages of results and maybe let's say 150 articles in it. A single article can be repeated multiple times in the 150. So you'll have to remove that. So this is after duplicating, and number of records screened. So this is the Prisma diagram. If you want specifically, there are it's available online. Just type in on Google Prisma diagram. If you read it completely, you'll understand it. Just read what the words say and you can understand it. So the fourth thing is case reports. Just so that you can unmute yourself at any point of time and you can ask me anything. Systematic review and meta-analysis are a little actually confusing. I took a little time understanding them before doing them. So yeah, coming to case reports you can Yeah, is there anyone speaking?
I know there's a question from
Yeah, sure,
Harish.
sure,
Um,
sure.
One second. Which is better between narrative and systematic reviews for CV?
Yeah, for your CV, systematic reviews are like way better than narrative review. I'm gonna tell which articles are better for your CV in the end. I have a slide for it as well. Yeah, please do asking your questions if you need in the middle. Yeah, and case reports. You can understand pretty much by the name itself. So case reports are basically you're presenting what you do in the ward, pretty much the same thing as you do in wards, but you'll have to present it. You'll have to write it in a much more professional way. So in ward, you write all the examination, respiratory system, CVS, RS, and everything. So while you're writing case report for a journal, if that system is not involved or if need not be reported, you need not write it you need not write it. It's like pretty much writing a short case but a little more detailed. So case reports, so if you have good amount of case reports in the specialty that you're aspiring, it will be a good add up to your CV. So case reports are better than literature reviews as well. Systematic reviews are also better than literature reviews. So yeah, case report defines that you have studied a case right from beginning to wherever you have reported. So case report need not end on the patient completely recovering. You can, the case report can abruptly end where the patient has not recovered but left the hospital and you cannot follow up. It can end like that as well. You can just report your findings until where you have recorded. It can be abrupt as well. So case report denotes that you have followed your a case that you are interested in right from starting and to as long as you can, as long as as the patient is available. So case reports are also very easy to be done. So for a case report, you need the permission of the consulting doctor. Obviously, you do not need the permission of the institution. You need the permission of consulting doctor and the patient's consent as well. So you'll have to get a form signed from the patient that I'm fine with this person writing about my case in a journal, and you'll have to need the consultant's signature that this patient so and so is under my guidance, is under my care, and I permit this person to publish this case. So there are case reports and case series as well. So case series are a group of similar cases or group of related cases. It can be in your institution, it can be in the multiple institution. They need to have something in common, which so that they can be called as a series. So and you'll have to discuss about that common element in the discussion part of the case series. So it's like let's say TB, you have 10 cases of TB which are a little peculiar. You have TB of TB, cerebral TB, you have lung TB, you have intestinal TB. You can form a case series on three of them with the common aspect of TB. Or let's say you have three different diseases of a lung. You can form a case series with the common point they are affecting the lung. So you need to have a common point. They can be at your institution or multiple institutions, and you'll have to discuss about it. Like, why are you writing this case series? Why lung is getting affected by these multiple diseases? So those are case series which are actually a little hard to write. Case reports are simple comparatively, but case series are a little hard to write, and they tend to get rejected most more because I mean I'm still an undergraduate. I do not have that much of expertise to write a case report. So write a case series. I've written one case series and it did not turn out good, but yeah, I do have two case reports published. So letter to the editor. So what is letter to the editor? So letter to the editor is hardly 1500 word article. It's like 1.5 page article in which you'll just go through the journal. You'll just write a commentary on the articles in the journal, or you'll write something about a topic which the journal publishes on. So yeah, commentary on the articles that the journal has previously published, or a short review of a concept among the topics that the journal usually publishes. So these are usually written by experienced people, but journals also prefer normal people also. I have started my research experience with a letter to the editor. I did not think it would get accepted because I used to have a perception that letter to editors can be written only by professionals and blah blah. So yeah, you can start your journey if you are at base zero. You can start your journey with a narrative review or a letter to editor as well. So yeah, this is a question that I very commonly get asked. So how do I select a journal? So I'll show you how I select a journal. This is the way that I do. I'm not sure if everyone does this. So I usually go to PubMed. If you want a PubMed indexed article, PubMed indexed journal, then there is no better way to search in PubMed. So let's take a random topic, paracetamol only. Paracetamol. So your topic, you when you have an idea and you want to select a journal for it, just type a keyword in the search engine. Let's say paracetamol and pain relief. So these are the keywords in my article. So see, now the search engine gave me a few articles, right? There are like 8 or 9 or 10 articles right now. So I'm opening the very first article, and this will give me a journal. So this journal publishes articles on my topic. That's what I understand from this. You can go with the second article as well. I open the second article and I open another journal. So this journal publishes articles on my topic, on the topic that I am doing. This journal is interested in publishing, and it has a good index since it's PubMed. So you want to know if your article is, if you want to know your article is compatible to this journal, all you have to do is go about and go to the instruction to the authors. Yeah, is my research suitable for MJA? So once you open this, you'll understand what the journal wants. What is a suitable research article for MJA? Not every journal has this. Usually journals have instructions to authors. So if you open the instructions to authors, you'll understand what kind of articles journals are looking for. Sometimes journals put a notification that we are not going to accept any articles relating to this topic, or sometimes they even put a notification that if you have any article on these topics, we incline towards it, we accept it much better. So DOAJ is also another search index like PubMed as well. So DOAJ actually you can actually, so let's not everyone of us can afford, right, to publish. Sometimes the charges could be as high as $2,100. So DOAJ has a filter to put free journals as well. I put in paracetamol randomly, and this will give me journals. Okay, I put pain relief as a keyword for my article. Okay, why is it not showing journals? So in DOAJ, you can put a filter without fee as well. Okay, pain relief also did not give, let's say, anesthesia. I'm just typing random word. Let's say my topic is on anesthesia. I put a filter without fees. So I'll get different journals which give without fee, which publish without fee, no charges. And here, no charges. So if you are okay with paying some amount but not much, you can remove this, and you can see the APCs here. How much? 910 USD, no charges. So once you decide if you want a journal with charges or if you want a journal without charges, you can go to the journal website, and then you can go to the instructions to the author. And in the instructions to the author, you'll have all the details that you want, like what kind of articles will the journal publish. So you'll just have to make sure your article is compatible with the journal. So I made a little map for it, so you can take a screenshot if you want. This is how I do. I'm not saying this is the universal way. This is what I found much easier. So yeah, PubMed and DOAJ are something that I used very usually. I prefer PubMed. If I repeatedly get rejected from PubMed, I'll go to DOAJ. So yeah, type the keywords, open the journal link of the articles, and go through the journal previous issues. This is also very important. Just go through the previous issues of the journal. Sometimes our article may not be as good as the standard of the journals. So that will actually save time. If we say, let's say Nature is like damn good journal. Just go to the articles of the Nature and look at I'll look at my article and I'll be like, okay, I don't think I can publish in a journal of this much standard. So just go through the previous articles and see how standard articles the journal publishes, and study the instructions to the authors. and check for the journal's requirements and ABCs. Sometimes journals require things like you'll have to have the references in this style, and you'll have the font and the size of the letters also. Journals will have instructions. So once you study the requirements, you'll just make changes if you want to. And your ABCs are the article processing charges. So if that is something that you can pay, it's like let's say it's very less and you can pay, then fine. But if it's a free journal, then no problem. Then just check the ABCs before submitting. And if you feel your article can, if you feel your article can oblige the instructions or can be modified, then you can send it to the journals. Follow the instructions and submit through the journal, and wait for the response. How do you submit to the journal? Just go to the instructions. There is an instructions page in every website, and it will guide you how to submit as well. If your article does not suit for the journal, you can always search for another journal in the search engine in the same process. So articles and their weight in CV. So how much do articles weigh in your CV? I would say original studies are always the best. And after original studies, you'll have systematic reviews and meta-analysis. And after that, you'll have case reports. And then after that, you'll have literature reviews. But if you have a literature review, like let's assume that you have published in a similar kind of journal. Let's assume you have a similar standard journal and you have published all your articles on that. Then it will be original study, and then systematic review, and then case report, and letter to the, and then literature review or letter to the editor. And also, if you write up on medical education, this is something that very few people do. If you write on medical education or public health, it will give you an edge on people doing research as well. Because let's say right now there are change in our education systems, right? Next is coming up, the transition from need to next. If you write articles on this, if you do any research on this, if you write even literature reviews on this, it'll be a good add up for you, because they want people who are interested in medical education as well. This is what I have heard. So okay, I've been to a conference in Jaipur, which is like an international conference. There were many program directors from US, Qatar, from England, Sweden, many countries as well. So this is what they told me. They told that very few people write on medical education, and we do like people who write on medical education. I don't know why they like it, but yeah, they prefer any articles in medical education. This is a small tip that I'm giving. So little tips to strengthen your CV. So there are Udemy, Coursera, there are multiple platforms like that, right? So you can do a Harvard course sitting from your home. You can do it for free, but if you want a certificate, you'll have to pay around 3,500 in Coursera, or 2,500, somewhere around like that. So if you get a certified course from Harvard, it, I know it's like, it's very simple. I mean, you'll have to put in some work, but it looks good on your CV. I'll just show you a little CV. So this is a CV from my friend. I blurred the names and all. So writing in sciences from Stanford University. This sounds very huge, right? But this is a 2 weeks course which is available on Coursera, if I'm not wrong. This is just not scientific writing, just writing in general. So, Fundamental of Cognitive Neurosciences from Laureate Institute of Brain Research. This is also from Coursera or Udemy. This is a 3 month course. You'll have to pay 3,500 in the end to get a certificate. You'll have to put in work, of course. You'll have to put in some effort. There'll be tests for it, but at least you are getting chance to get a certificate online by paying 3,500 or 2,500, somewhere around like that, and you'll get these words in your CV. Like if you have this in your CV, it'll be a huge edge than many others, right? So yeah, introduction to systematic and review and meta-analysis from John Hopkins. Just look at how much this will add in your CV. When someone looks up at your CV and sees these things in your CV, all you have done is uh, it's hardly 1 to 1.5 hour per day. I know it is, you have to put in effort, but it's much better than many other things. So you can do these in Coursera or Udemy or any other platform like that. And even ICMR offers such courses, certified courses as well. For postgraduates, you have a BCBR, which is a mandatory, but as an undergraduate, it's not mandatory, but you can do it and get a certificate as well. BCBR is basics to research only, but you'll get a certificate that you are certified by ICMR. And there are multiple undergraduate conferences that happen in Ames Delhi, in JIPMER, in AFMC, and in many multiple colleges. You can just go there and you can present your research and get a certificate, and also you can participate in diverse workshops. So if you present your research in institutes of national importance, INI. If you present in INIs, the Ames and the JIPMER, you'll have a little more edge than the other conferences. and the AHA, American Heart Association BCLS certificate. I don't think going without this will do good, because you'll need to have this certificate if you want to go there for an interview. You need to have it. It's like a must. So yeah, these will be held at multiple national institutes. Just a month ago in Jipmer, the AHA people conducted BCLS workshop. You'll have to have this BCLS certificate before you go to US. And yeah, try to get involved in student organizations that are recognized legally. So SMR is not a recognized legal organization. It's pretty much a WhatsApp group. So there are a few student organizations which are registered. There's SIMSA, James, IFMSA, not IFMSA. You can MSA in India. So IFMSA is like BAPA of all the medical organizations. It's an international one, and there's AMSA as well. These are all legally registered organizations. So if you join in those organizations, if you contribute something, you get a certificate. It shows to your program directors that you are involved in something other than just mugging up. And try writing about medical education and public health. It's what I told you previously. Medical education and public health, right now we are having a lot of changes in medical education. So this is like a good opportunity for us to write about it. The next and NEET is a huge transition. You can do perception studies. I put a CAP studies, right? Knowledge, attitude, and perception of students. You can do CAP studies. You can collect opinions of students and write a review article about it. You can you can or else write some general things about it. So yeah, do you have any questions to ask? Anybody?
Satwik, can I say something?
Yeah, sure, sure.
Yeah, guys, I think we are done, Satwik, right?
Yeah, yeah, we are
Yeah,
done.
yeah, yeah. We are open up for Q&A, guys. Please feel free to ask your questions. I know many people have many questions. Please don't hesitate to ask. If it is a small question or you don't feel like it is a vague or it would be vague, nothing like that. Everybody are at a starting phase only. So yeah, please open up with your questions and please put it in the chat box, or you can directly on your mic and ask them. He's right here, he can answer that. And do consider filling the Google form also, which I have put in the chat session. So please come up with Q&A questions.
Okay, before you ask, I'll answer a very basic question that many people ask. It's like, how do you start as a student? Not many people will support you. You'll not have your college supporting you. To be honest, my college never supported me in research. I have Rakesh sir is also from my college as well. We initially had no clue about research. Somehow, randomly in lockdown, luckily for me, I came to know that this thing exists, that research exists. We have to write articles. I tried for fun and I really loved it, so I started getting into it. I started with literature reviews and letter to editors. For these literature reviews, you do not need anybody's guidance, right? So back then there were not many student organizations as well. So one of my seniors was involved in research. He has published one or two articles by then. So I asked his guidance, and I was involved in one literature review, and from then I started writing. I have, to be honest, I've written like 10 to 15 literature reviews in lockdown, which were very bad. They did not get published, but at least I got to know how to start. I got to know how to write. I got to know how not to write, because all the 15 articles, if I look now, they are very bad. I even wrote an article how taking ganja can get you away from COVID. That was stupid, but I wrote an article. That helped me give an experience how to write and how not to write. So yeah,
One second, Satvik, is that a literature review?
yeah, that was a literature review.
How
That
did
is,
how did you get the articles, man?
there were articles that
Really?
cannabinoid. Yeah, there were articles from US that cannabinoids can help prevent COVID.
Okay.
I didn't know how high the person was when he was doing this, when they were doing this. So yeah, you can start like with literature reviews, and you can just go to one undergraduate conference. Just go to one undergraduate conference and present there. Just one conference. you'll have so many connections. You'll get so many connections. You'll get so many people with similar minds, and they're going to text you that, see, I have this idea. I have this much people. Will you contribute for my article? Once you start going to conferences, you'll have so many people who want you to write article, who want people to write article, who need manpower or who need ideas. So this is what I suggest: just go to at least one undergraduate conference and present there, one good undergraduate conference and present there. Even if you do not have a research, take a friend's paper, say, just say that it's not ethical, but say that this is my paper only, and then go there and you present there. It's fine. You'll get so many contacts, you'll get so many people you'll meet. You'll just a new world opens for you. So that's how I started. I went to a conference in Pondicherry first, and then I met so many people. I've written articles in that way. So any questions, anyone? Yeah.
So one thing I want to ask from my side:
Yeah, sure, sir.
can a graduate do a case report or an original study?
I didn't get you, sir.
Can
Can
a
you?
graduate do an original study? Because it is hard to
Yeah,
get
yeah,
an
yeah.
ethics committee approval.
Yeah, so I'll suggest something. You can have your junior take a permission from ethics committee, and then you can do along with that person. I mean, this is a hack. So even though you're a graduate, obviously you will be in touch with your juniors. Or see, I've done two original studies, and none of them were from a college. I did not visit the patients. It's because those original studies were done in somewhere else. One of them was done in Pune, and the other was done in Kakinada, which is 1 hour from my place. So this Kakinada thing, I had the chance to go on ground, but the Pune thing, I was only involved in documentation. I was only involved in the writing part. So if your college is reluctant to give you an ethical clearance, all you can do is use your connections from other colleges, ask your friends, because there will be at least one person in some random college who is doing the research. You can get that contact from your friends. You can talk to them, ask them if it's possible to get an ethical clearance from their college, and then that person in that college can do the on ground work, and you can do the writing part. So if you're a graduate, try asking your principal. If your principal is considerate, I don't think many principals are considerate enough to give ethical clearance for graduates to do research. That to original study. So you can ask a junior to ask a principal. Once the junior gets it, you can do it, I guess. So
Yes.
any more
Thank
questions,
you. Any
guys?
more questions, guys? Please
No, if
feel free to
there
ask
are no
them.
questions, it's fine.
We will end the session within 5 minutes. So there's a
Yeah,
question. So how do graduate get ethical clearance? I think you just answered that.
yeah, but yeah, I'll answer that again, sir. So like how I just told you, once you're a graduate, you can go talk to your principal or the ethical clearance head, whoever it is in that specific college. If they are considerate, they would give you an ethical clearance. But if mostly they are not, many of them are not so friendly. So you can ask one of your juniors who's right now studying in the college to to go to the ethical clear to go get the ethical clearance, and you also can be involved. You can take permission for that. This is more feasible. Or you can involve in studies through your friends which already got ethical clearance. Like I told you, I was involved in a study which was done in Pune. That was not my college, but one of my friends was studying there. He got the ethical clearance. I did the writing part. I did the discussion part, the statistics part, and the on ground work on patients he did. So the case reports case reports do not require ethical approval. Case reports require only two things. One thing is consent from the patient that they are okay with you writing this case, and the second thing is permission from the consultant, like the doctor who is seeing this case, the professor or the consultant who is seeing this case. You need a permission from them. To be honest, even the permission from consultant is also specifically not required. Ethically, like for your inner self, you may get it. If you do not have the permission, also just take the consent from patient, and you can proceed. But it's better if you have the professor's sign as well, and he'll guide you. I mean, they will guide you if you need for a case report.
Yes, at
They'll
least
not.
to add something to what he said, at least while you're giving for publication, it is useful there when you get a consultant. Am I correct, Satvik?
Yeah, yeah. If you have a consultant opinion, it'll be very different. But if you do not have cooperative consultants, you can take the permission of the patient, make the patient sign a consent form, and you can publish it.
And one more question from my side before someone asks
Yes, sir.
something. It's a scratch question. How to
Hmm.
select a research topic first? How to select a research topic? I mean, I have no clue on what to do. So how do I approach? I mean, how do I come up and select the topic for specific topic to do
Okay.
the research?
Okay. Since I know that I'm talking to crowd who are going for USMLE, so you have yourself. You are aspiring for a specific specialty, right? So you're interested in pediatrics. Someone will be interested in gastro. Someone's interested in surgery. So first, narrow your topics based on that. Just go with surgery. Okay. When you have like a blank mind, you don't have any idea. Just go open PubMed or DVJ, type surgery. Okay, you'll have journals that are specific to surgery. Open the journals and study. Just go through all the articles. Don't do anything. Just flip the pages like just slide the pages like you're flipping the pages of a novel. Just go through, study the abstracts. So abstracts are like summarized versions of the all the articles. So you'll have abstracts for free. You need not pay anything. So once you study the abstracts, you go through multiple journals, you'll automatically form up an idea in your mind. You'll relate that to something in your college, some patient that you see.
And
If you do not,
can you add something about up to date? There is a website called Up to Date also.
hmm, I'm sorry, I'm not aware of up to date. I'll just Google it now.
Yeah, there is a website called Up to Date where all the um, all the
Okay.
branches they are divided into all the branches. The research topics are divided into so and so branches. So you can search just as Up to Date Pediatrics, Up to Date OBGY, Up to Date
Okay.
General Surgery. You can search there and you can find recent advances or recent
Yeah.
researches.
Yeah. Then up to date is like a very good
Yeah.
platform for it, I guess. And also you can even LinkedIn, many people post their published articles. You can get an idea based on watching their published articles as well. It's really good to have an inspiration. I mean, you're not just copying their article, no? You're just getting inspired from them. Is systematic and review and meta-analysis is possible as easy to do alone. So to do alone, systematic review you can do, but meta-analysis, I personally I am not good with math, statistics, and software, so I cannot do systematic meta-analysis. Systematic review is possible. You can do it as UG alone by yourself, but you might need the help of your SPM department for the meta-analysis. Systematic review can be done as an review alone, which is harder to do. Systematic review or case report. Systematic review requires more time and effort, usually when compared to case report. So if sometimes cases can be like 8 months, you'll have to follow for 8 to 9 months. There was one case in my hospital that I wanted to write, which as is still in progress. It's been 9 months, so that is something. So you'll have to compile all the reports of 9 months in just one page, na? So it's very hard. So other than such types of cases, usually systematic reviews are a little harder because you'll have to randomly you'll have at least 10 to 15 pages on PubMed when you type a keyword, right? So you'll have to eliminate all the articles. You'll have to systematically group them. You'll have to study all the articles and you'll have to include or exclude, and then you'll have to summarize them. So they need a little more effort than a case report, usual case reports.
And to that question, adding to that question, so for systematic reviews and narrative literature reviews or case reports, you need not have any data with you, and because everything will be published or seen
Yeah.
on the paper. But for case
Yeah.
report, for the case of for the publication, I think you need the lab reports and all the concerns ready with you. If at all they asks you, I think you need to send it to the editor, right? So
Yeah.
can you talk about that?
Yeah, to be honest, they will not ask the lab name and report. So if you mention that these are the values that you have seen in the report, that will be taken. Like you can mention that when the patient joined, the patient's potassium and calcium were these values. You did not put up an image with. It's not compulsory. If you put up, it's fine, but it's not compulsory that you put a report of values. So what reports are so if you have an ultrasound or if you have a CT, these are must. These have to be put in there because an ultrasound and CT are to be put in there. But lab reports and all you need not. The consent you must consent is must. You'll have to need have the patient consent. And if there's a case of ultrasound or if there's a CT or if there's X-ray, it will be much better if you put those on the in if you put this in the manuscript. But lab reports you can type it out. I don't think journals will ask specifically for the proof of lab reports, but if in any case they do ask, you might need them. You'll have them in your phone mostly. So can case report be published if the patient treatment is not complete, like planned surgery isn't yet performed? Um, you can write, but I don't think many will accept. I mean, journal would accept it because. Can you be a little more specific, Dr. Adnan Ismail? So patient treatment is not completed. The patient is planned for a surgery. So if let's say it's a very rare case, like it's a rare disease, you got the patient, but the surgery is not done, the patient just left. You can publish the case. But let's say if it's something like hernia, you want to the surgery is not done, but the patient took medical treatment and left. It is not favorable for journals to publish it.
Yeah, I can give you an example.
Yeah, sure.
With it is not related to surgery, but it's related to some AML. I think I discussed with you, Satwik. So
Yes, yes, sir.
this particular case, it got admitted at a hospital. They suspected ALL initially because of the pediatric age group and the other findings. They suspected ALL, acute lymphoid leukemia, but the bone marrow aspiration is not possible that time because the patients are in a hurry. So the resident told them we are suspecting like leukemia, and the patient attendants and the mother and father are really they are very nervous and to know the diagnosis first, so that yeah, so they're adamant to leave the hospital at any cost, and they asked for a referral for other institution where they can get the bone marrow report fast. So what we did is we send the referral. Now I'm currently doing that case. So now what's happening is it's really hard for me to get the data from there. I mean, what's happening there? Only data I got is the bone marrow report, and the other thing is karyotyping report and the chemotherapy. They told me that they are going through chemotherapy, and the 3 sessions are already done and 2 more left. So that is the only information I got. So what I am doing is I'm trying to. I had no photos, nothing and nothing. So I'm trying to go to Google and search the presenting like he presented with gum hyperplasia. So I'm trying to get the photos of gum hyperplasia in a 9-year old child, because nobody is going to see the face of a child, or nobody is asking you. So just a presentation. I'm just downloading them, and the imaging karyotyping photos. There will be photos for karyotyping thing in the report, and that for those photos. And I'm just assuming that this particular AML fits into this particular class. There are about M0 to M7 classes in types in AML. So I just assume this might be fit into this, and so the treatment regimen is chemotherapy. I'm assuming that, and I am doing the case report with the help of my postgraduate. So yeah, you can you can do you can do write reports, and you can even publish things if the case is not there at your hospital right now. So yeah, I just want to add that point.
Yeah, also, there are actually now journals have new search engines because of the advancement of AI. So if you use ChatGPT or if you use Google Photos, they'll detect and reject article. Advanced journals have this, like very good standard journals. If we use any Google Photos, they detect and they reject our articles with plagiarism. So if you have, I would say, then their chance of yeah, there is a chance that they would detect plagiarism in the pictures. So I would say if you have the pictures of the person, it's very good. If you do not have, also you can proceed without the pictures as well. It's if the journal specifically asks, then you can. I would not suggest to do that, but yeah, it's up to you.
So there, then their chance of getting plagiarism, about
Yeah,
plagiarism.
there is chance of getting plagiarism because the image is from Google, right? If it's a very standard journal, they have right now they have very good detection systems. They're going to detect that this picture is from Google and they're going to reject the article.
So there's one question
Yes, sir.
they texted me. So have to write an original article and publish. How to approach first?
So the first thing is, let's say you have an idea. I'll again take the paracetamol and diclofenac one because it's simpler to understand. You have an idea. So for an original study, basically as for the guidelines, you'll have to need a guide who's a who's a professor or assistant or associate, whatever, who has to be a faculty or at least a postgraduate. This is the basic guideline, but you can do without them also. But this is a basic guideline, so you can approach one of your faculty members or one of your PGs. Your PGs would be more than happy to do because they're mandatory. It's like they cannot pass if they do not publish an article. So if you give them an idea, they know that you're going to work on it. All they have to do is they get permissions, right? So they'll be more than happy to work. They'll be more than happy to get permissions for you. So approach any PGs or approach any faculty members. And in your college, if you're yeah, in your college, if they you'll have to go to your principal and ask ethical committee who's the head of ethical committee, or go to any faculty member who you know and ask them who's the head of ethical committee, how who do I have to get permission from. So once you go there, they'll give you a form. They'll give you a form of like the signatures that you have to put, the form that you have to fill. There will be few formalities to get ethical clearance. So in my college, I'll have to get clearance from my principal, from the topic, the specialty HOD, and the guide, and then there are three members in the ethical committee. So I'll have to get all the signatures. So there will be formalities like this. So you'll have to finish these formalities, and you'll have to submit an abstract, rough abstract, and how much time you need to finish the project. The time is flexible, like you can finish 1 or 2 years after that also, it will be fine if it's within your own college. So you'll have to put a rough time, like I'll finish in 6 months, and then you'll get the permission, and then you go to patients. Have to go to patients, and you'll have to go. So you have to make sure every patient signs a form that I'm fine with getting admitted in this research. You'll have to usually we'll just ask the patient to sign here, sign here, sign here. They'll sign. But if anyone asks a question, you'll have to explain. So ethically, you'll have to explain the patient that this is what I'm going to do, and how to approach publishers or authors with original research. So I've told you, right? You'll have how to select a journal. So you'll have to search for a journal, just open instructions for the authors in the journal. Any journal website, open instructions for the author, and there'll be detailed and steps of how to approach that specific journal. ICM or STS, if you have a STS, it will be a very huge boost to your CV. Yes, UGSRS and okay, yeah, YSRUH is also very useful. STS is like gold standard. So if you have STS in your CV, it will be very useful. But sadly, interns cannot do STS. Unto 1 to 4 years, final year people, you can do STS. And UGSRS is also useful, but STS is prime, and then UGSRS. So for people who are not from Andhra Pradesh, UGSRS is the research program that is similar to STS, that is present only in Andhra Pradesh. So STS is a program by ICMR. ICMR is Indian Council of Medical Research. So for that, every year they give grants of 50,000 to 1,500 students. So all you have to do is you have to submit your idea to them in the format that they ask. They have few guidelines in their website. You have to submit your idea to them. They'll be having like 2 weeks of time. So they'll announce it, and within 2 weeks they'll close the acceptances. So you'll have to submit your idea in the format, and if they like your idea, 1,500 ideas they're going to select, and they're going to give 50,000 each for all those ideas. And you'll have to finish this in I guess 10 months. You'll have to
Uh,
finish. Hmm.
Yeah, complete it, please.
Yeah, you'll have to finish this in 10 months and you'll have to submit your results to ICMR.
So
Oh, once.
the
Hmm.
notice regarding this, I think we are already shared in the inside group. I think people
Okay.
have joined who have joined late. They might not know it, but already we have shared it. I'll share it again in the group. The notice which Satvik is talking about regarding the YSR UGRS thing. And one thing which Adnan asked, usefulness in USMLE. So I just wanted to say everything is useful in USMLE. Okay, so something is better than nothing. So anything is useful in USMLE. It just shows your interest. You just you need to do one thing, which is to be program specific. To which program are you interested in? You just be program specific, and you start everything from scratch, and you can go until some ISM, ICMR, whatever you do. Anything from scratch works. It just shows your interest. Group link, inside group. I'll just share the inside group and SMR. Satvik, can you?
Yeah, yeah, I will. I will.
Yeah, we'll be sharing both the inside and SMR group links, WhatsApp links here.
So, are there any more questions? And also, research is mostly fun. It's not stressful. I'm not interested in USMLE, but I'm still doing because I like research. So you can, I can we submit the same report for different journals when in both journals have the same? No, 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 no. It's not possible. So journals, every journal have this one rule. If you submit something to a journal, it should not be submitted anywhere else. If they reject you, then you can submit to one more journal. But as long as it's not rejected, you cannot submit to any journal. Submitting to journal is like you're in a relationship only with one. No, if it gets selected in multiple journals, you'll be tagged with plagiarism. The one that published second, so let's say you submitted to two journals. One journal got published first, and the second time when it gets published, it will be tagged with plagiarism and it will get cancelled. So then you'll be black marked by the journal. So even submitting also, just submit to one journal. If you get rejected from the journal, submit to another. That's it. Or if you want to withdraw, just send a mail that I want to withdraw from your journal. Just apologize and say I'm going to withdraw. So they are going to cancel considering the article.
And one more thing, this particular PDF of the this particular webinar will be shared in the group. And also, Satvik, if you have any leads, I mean the structure, how to write a case report, how a
Hmm.
literature review should be, our the structure, the blueprint. If you have any kind of those, you just forward it in the group. I will
Sure,
be
sure.
sharing. I think I have a couple of those, so I'll be
Okay.
sharing them too. And what is a journal
Journal.
impact factor?
So impact factor, it's like TRPs. So how TV channels have TRPs, journals have impact factor. So the number of people it reached to, number of people that are observing the journal, that are subscribing to the journal. It's like how much reach the journal has. It's like the views on Instagram. It's pretty much the same. So a journal with higher impact factor is reaching to more number of people and is known as a standard journal to many number of people. Let's say Elsevier. Usually Elsevier journals have good impact factors. I mean there are journals in Elsevier which have very less impact factors, but in general Elsevier has good standard journals. I think many of you know what Elsevier is, right? Because Elsevier is famous. Many they have books, they have journals because they have good impact factor. So many of us know Elsevier. So when you have a good impact factor journal in your CV, let's say you published in this journal in Elsevier, the interviewer is going to know that, oh, I know this journal, this is a good thing, this is a good journal, and this person published in this, which means they have done standard work. So yeah, impact factor is important. Usually an impact factor of 1 is huge, it's like very good. If a journal has impact factor of 1, it's very good. If it's somewhere around 3 or 4, it's like very huge.
Usually it is presented in points also, right? Decimals also.
Yeah, you mostly it's in decimals.
Yes. Okay. Thank you. Thank you. Okay. Any more questions, guys? Any more questions?
More
We'll just
questions,
wind up.
or we just wind up and end it?
Yeah. Because I think we need to go to duty now, I think. Satvik.
Yeah, I'm on call today, that's it.
Okay. So, guys, please speed up and ask any questions you have, or else we'll wind up. 2 more minutes. 7:45. We'll wind up.
Yep. And thank you for joining on a Sunday evening.
Yes. Do consider filling this Google form, guys. This is all. This is about how the session was and any additional questions. And also, if you need any topics further to be discussed, you please know. Let us know in the Google form so we can bring up sessions like that. So yeah. Any more questions? Please free to ask. 1 more minute, Satvik. We'll wind up. We'll
Yeah,
just
yeah,
wait
sure.
for 1 minute.
Sure. I really hope you got some. Can you once tell me about free courses? Okay, there are not many free courses. Okay, there are free You can, if you want anything specific about research, you can just go on YouTube. You can learn a lot, and but they are not certified. Just for learning sake, you can get it. And there's free course from ICMR, BCBR, if I'm not wrong, BCBR, which is free. I think you'll get a certificate. I'm not sure, but it's mandatory for PGs. The PGs have to do that course. They have to get a certificate. But for undergraduates, it's not mandatory. But you can go and do that course, which is for free of cost. And even in Coursera and Udemy, there are courses which you can see free of cost, but you'll not get certificate. If you need certificate, you'll have to pay.
And also, few organizations like USMLE side, SARTHI, and Good Research Project, a few organizations like that will be conducting free research workshops and classes now and then. I'll be sharing the links of everything in the inside group. So stay tuned because yeah, it's not mandatory because people don't do it often. So once in a while, the free courses will you'll get it, and a free course with a certificate is an added advantage for you. So just stay tuned. We'll just inform you everything in the group, and I think I'll just find out and I'll just share if I get any information, and yeah, regarding the courses. Okay, then I think we are done. So ending up with thank you, Satvik. Thank you so much. Uh, yeah, thank you, Satvik. Thank you so much for this valuable information. So far, this is the best webinar for me
Thank you.
from
Thank you.
USML Insight. It's
Thank you,
very
sir.
it's very insightful. Every information you gave. And guys, the PDF will be shared in the group. And if you have any doubts, additional doubts, you can contact Satvik. I'll be giving the number also there in the group. He's present in the group also. So
Yeah, I'm
thank
in the
you from my side and from the inside side to you and the
Thank
SMR.
you, sir.
So
Thank you for letting me speak today.
no, thank you so much. Thank you guys for attending. Yeah, bye guys.
Bye.